Heart disease is not an old man's disease. We just heard about that earlier. It's actually the leading cause of death among American women. Dr. Elizabeth Dang is a cardiologist here in Kansas City, and she is here to share just a few facts on heart disease in women. First of all, how do you get heart disease, and more importantly, how do you prevent it, doctor?
Those are great questions. Thank you for having me this morning. Heart disease occurs when plaque, sometimes made with cholesterol and other particles, starts to clog the coronary arteries, which ultimately causes obstruction, no blood flow to the artery, that causes a heart attack. And in terms of prevention, we think about sort of the 5 most common risks and realize that fully 80% of heart disease is preventable. So if you think about the main risks, number 1 is family history. You don't have a choice which family you're born in, but early premature family risk for heart disease is one risk factor. Number 2 is high blood pressure. Number 3 is high cholesterol. Number 4 is diabetes. And number 5 is a smoking history.
Got it. Now, by the time a woman comes to see you, is it DEFCON 5? Is it so severe that they can't be helped? Or talk about the severity of when they actually come to see you. They need to be preventative.
You know, that's a great point. We see a lot of women as what we call secondary prevention, meaning by the time they go to see the cardiologist, they've already had a diagnosis of heart disease. But we also see quite a large number of women for preventive cardiology, meaning these women have been educated, they're proactive, they know about what their risk factors are, they've had great care from their primary doctors, and we see them looking for things that we can do to help prevent heart disease, as opposed to already having it and then trying to prevent further episodes.
Now, you personally, Dr. Dang, why are you so involved? I mean, why are you so involved in women and heart disease?
You know, we use the statistic of heart disease affecting 1 in 3 women. To give you some perspective,
that is crazy. 1 in 3.
Breast cancer affects 1 in 30 women, so 1 in 3. The story I have is the story of every woman in this country. You know, my grandmother had severe heart disease and had a massive heart attack when I was in medical school, and she ultimately never made it out of the hospital, and that really left a huge impact. And when I was in training, one of my senior physicians, we had actually gone out to exercise at the gym, and she was in her early 40s, had horrible family history, no other risk factors, had a normal stress test a month earlier, and had sudden cardiac death in the gym. And I actually coded her, and we took her to the emergency room, and she ultimately didn't make it. So these are really powerful stories of women in my life that have impacted and make me passionate about getting the message out.
We're encouraging our viewers to invest in research and education to save lives. So how can an investment today, how can that help women's health tomorrow?
The 2 key things with investment are, number 1, education. The American Heart Association has all sorts of campaigns to help empower women, because the message, the education, empowers you. And because 80% of heart disease is preventable, if we can get that message out to a young woman, or even a woman in her 60s or 70s, it's never too late to start preventing heart disease.
80% is preventable. Thanks, Doc.
Right.
Thank you, Doctor. We appreciate it.